Hi, welcome again to the Chiropractic Mentors Q&A session. Now, just recently somebody asked me, one of my mentees asked me about relationships with patients. Okay, the question specifically was, should I be friends with my patients? I think there's a few different ways of looking at this particular question, and let's define it a little bit. So we're not talking about romantic relationships with patients here. You know, that is something different, and we're not going to go into that for, I guess, obvious reasons. Now, so when we're looking at friends, okay, so what does that mean? You know, you get along handsomely, you'll share ideas, and you have chats, and you talk about stuff that is potentially outside your clinic remit. You know, maybe you even get together outside clinic for hobbies, activities, whatever it may be. I don't see a problem with that personally. I mean, goodness me, if that goes against law in some countries, then, you know, so be it. Then you must be cognizant of that. But personally, I don't see a problem with that. You know, you're free to choose your friends. I think the only caution there is with confidentiality and those kind of things, where, you know, your patient needs to know and needs to always remember that whatever they tell you is confidential. You know, you're not supposed to go and blab about it to anybody, even if they are mutual friends. You know, you don't talk about it. It's not your place, and that is very important. The other thing is, of course, way of looking at it is that should you ever do business with your friends? Should you ever go into business with your friends or this kind of thing? And maybe this is you could view it as a business interaction, you know, where a chiropractor and a patient. But there can be a blurring of lines, obviously, when people become more friendly with one another. So you as a chiropractor, you do need to maintain that wherewithal, that you know what's what. And you always consider, you know, what am I comfortable with? And if it turns out you're not comfortable with something, then you either have to, you know, have a conversation with this person. If they're good enough friendship material, they will totally get it. If they're not, if they're looking to somehow cause you ill, then they'll probably disappear, because it's clear that you wised up to their trick, you know, as it goes. But the point is, have a think, keep your wits about you. So don't just kind of be the best buddy to everybody. You can be friendly. There's nothing wrong with that. I always try and be very, very friendly with my patients, purely because that's kind of just the way I am. So I tell jokes and I like my job. So moral of the story is, have a little think, have a big think, and be awesome.